Hi, good morning. First of all, I'd like to thank Stanford colleagues for organizing so wonderful meeting for us. So today, I'd like to share with you about our work we have done over the past 5 years about acupuncture and herbal medicine for the treatment of the psychiatric problems. As you have known, mental problems has become a serious public health problems worldwide. In China, the prevalence of any mental problems is as high as 9.3%. In here, Hong Kong, the prevalence of common mental problems is high as 13.3%, particularly like depression, anxiety, and also substance abuse. Pharmacotherapy is still a mainstay of the treatment of the mental problems. However, there are many kinds of limitations. For example, it has only limited efficacy. Pharmacotherapy medications always cause tolerance, addiction, and dependence. Of course, they always has many kinds of side effects, such as body weight gain, metabolic syndrome, and also movement problems. In traditional Chinese medicine, there are many therapeutic approaches that could be used to deal with the mental problems. The best renown for us is acupuncture and acupuncture, acupressure, and herbal medicines. Actually, in Chinese medicine practice, we often use moxibustion, cupping, scraping, trainer, massage, dietary therapy, and even TCM psychological therapies. The most famous should be exercise therapy, such as the best renowned Tai Chi and Ba Duan Jing. Due to limited time, today we only focus acupuncture, acupressure, and herbal medicine. Acupuncture actually belongs one kind of nerve, so stimulation therapies. Over the past 3 decades, brain and nerve stimulation therapy has become more and more popular because in psychiatry, some non-pharmacological therapy such as ECT, RTMS, and brain deep stimulation, BDS, and vagus nerve stimulation has the apparent advantage compared to pharmacotherapies. Acupuncture belongs to nerve and brain stimulation therapies. In acupuncture, there are many kinds of models, such as needling acupuncture, which is the classic treatment, belonging to invasive treatment because we need to put a needle into body. In addition to needling or invasive treatment, acupuncture and also use non-invasive, such as transcutaneous electrical acupuncture stimulation, TEAS. More convenient is acupressure. So this slide shows neural pathways of acupuncture. When we put a needle to here, for example, like Herbal, Zhu Sanli, the two most commonly used acupoints. Acupuncture stimulation induced neural signals are carried out by peripheral nerve system into such as spinal cord, brainstem, and anterior cortical area, producing broad neural modulations. Here, I'd like to show a very special acupuncture model, which is called dense cranial electroacupuncture stimulation, DCS, or electroacupuncture trigeminal nerve stimulation, ETAM, because forefrontal area is innervated by first branch of the trigeminal nerves. Over the past 5 years, we have completed 2 clinical trials to test efficacy of the trigeminal nerve acupuncture stimulation. One is in chemobrain. Chemobrain is chemotherapy-induced cognitive impairment. So another clinical trial is what's carried out in patients with post-stroke. In chemobrain, trigeminal nerve stimulation produces much better outcomes in reducing cognitive impairment. And from here, we just use a very special clinical assessment, which is called reverse digital data test. And from here, we can see EA TNS plus BA had less errors compared to minimum acupuncture stimulation controls. More interestingly, trigeminal nerve acupuncture stimulation and also improve the tenseness and headache. In post-stroke, trigeminal stimulation therapy and also produce much better outcomes in improving depression, disability, and also cognitive impairment. Actually, in China, acupuncture has become routine therapy in psychiatric hospital. So here we just published 1 retrospective control studies to assess efficacy of the EA electroacupuncture in combination with ECT in patients with schizophrenia. Survival analysis clearly indicate EA additional treatment could produce much better in reducing positive and negative symptoms. Another is very important findings, and from these retrospective control studies is that EA combined with ECT and also can much better control antipsychotic drug induced weight gain. And from here we can see, here is control. Control means only use medications. EA and ECT and EA plus ECT weight gain is much less than the control group. So another non-invasive acupuncture stimulation therapy is called transcutaneous electroacupuncture stimulation (TEAS). And also over the past 5 years, in parallel, we also have completed two clinical trials of the TEAS to treat. One is for OCD, so another is for PTSD. PTSD medication is very less efficacy in reducing PTSD symptoms. In clinical practice, standard treatment should be CBT, cognitive behavior therapy. And in both of the OCD and the PTSD clinical trial results indicate TEAS in combination with the drug medication and the CBT, TEAS could increase actual 20% of clinical remission rate. In the last year, we conducted another large-scale clinical trial by using auricular vagus nerve acupressure in people who are under COVID-19 pandemic. We just use smartphone form-based randomized control trial. So this just show. So this slide show the auricular vex, the branch nerves. So distribution in the L area. So BCT show and how to do L, the auricular vex now pressure. So pressure here, and second to here this area, and 3, 4, and 5 step. So place here. So this clinical trial conducted in Wuhan, Beijing, Guangzhou, and Shenyang between February 26 to April 28, 2020, when that is just a peak time in China of the COVID-19. So we recruit a total of 406 the people. So results clear indicate acupressure in L area can get much better improvement for emotional symptoms. So this improvement could be observed as early as at day 3 until throughout day 14. So another clinical trial, one Dr. Lao Lixing, who worked in our Hong Kong U, we just teams with the nursing school. That is about self-pressure of caregivers, of all the family members. As you may know, caregivers of all the family members always has very heavy stress. So we just use some point for acupressure, such as 中脘、气海、关元、足三里 and 百会分池、肾腧、合谷、涌泉. So all of these comments, so all of these acupoints are very commonly used for acupressure. Yeah. So results is clear indicate acupressure caregivers can get greater improvement on stress, fatigue, depression, and also physical health related quality of life as compared to waitlist people. So when I joined Hong Kong U in 2006, we had done a lot of the clinical trial of acupuncture, treatment, depression. So the paper was published in 2008. So second clinical trial of the acupuncture for the treatment, the depression, was done in Guangzhou in collaboration with Professor Huang Yong. So this we just use acupuncture as an additional treatment for the major depressions. So another colleagues in our Hong Kong U, so Dr. Chong Kai Hui, who is psychiatrist in Department of Psychiatry Hong Kong U, he did a lot of clinical trials for using acupuncture for the treatment insomnia. So this for postpartum depression. So this is for post-stroke depression. So this clinical trial was done by Dr. Yan for acupuncture for primary insomnia. So second one, and also Dr. Yan, again, acupuncture for depression-related insomnia. So this was done by Dr. Chum, and also to use acupuncture for depression-related insomnia. So next, I'd like to briefly share some results about Chinese herbal medicine. In the last month, we published one international collaboration meta review of the meta-analysis of herbal medicines. In this meta review paper, we recommend some classic Chinese medicine formula for the treatment of the depression, such as 柴胡疏肝散、逍遥散、甘麦大枣汤, licorice, wheat, and jujube combination decoction, and also fungi extra capsule and the stagnation sauce and the depression relieving capsule, and also 温胆汤、九味镇静胶囊 and the 龟皮汤. All of these formula either classic or empirical Chinese formulas. So actually, I have done the large scale clinical trial when I worked in the United States. So best renowned is free and easy Wanderer Plus. Free and easy Wanderer Plus. So we just use this classical Chinese formula, Chinese herbal medicine formula for the treatment of the bipolar. So this and also for the unipolar. So, and when I come back to Hong Kong, we use the free and easy Wanderer Plus for the treatment of the PTSD. So in 2016, we published another larger scale herbal medicine clinical trial for the treatment of the young people with tics. So with a tic. So that is formula is an empirical formula that is called 5-lin granules. So, and also we had done 2 clinical trials by using the classical Chinese herbal formula that is called 芍药甘草汤 peony licorice decoction for the treatment antipsychotic drug-induced hyperpolyrechemia. Because hyperpolyrechemia is a very common side effect induced by antipsychotic drug. So first pilot is first clinical trial is pilot clinical trial. So second clinical trial is the randomized control large scale clinical trial. So herbal medicine is just a routine therapies in China, because most China psychiatric hospitals use herbal medicine for the treatment some side effect of the medication, and also can treat some enhanced efficacy of the antipsychotic drug. So most recently, we complete one control randomized trials by using berberine to treat antipsychotic drug-induced weight gain and metabolic syndrome. This we just use placebo. So which one is berberine? Which one is just placebo? So the right side berberine, left side just placebo. So we recruit a total of 113 schizophrenia patients who already had metabolic syndrome and body weight gain. So treatment outcome, berberine treatment produce much better outcome in controlling weight gain. And from here after 12 weeks of treatment, berberine treated patient so get a weight loss about 1 kilogram, and also reduce BMI and reduce waist circumference. So berberine and also can normalize multiple metabolic the index, including blood pressure and LDL, and also fast blood sugars. So right now we have 4 ongoing clinical trials. First one, we use combination of acupuncture and acupressure for the treatment for the management of community drilling elderly with dementia. Second clinical trial transfer and from so Dr. Lao Lixing when he left and from Hong Kong U in 2019. Title is Effect of Acupuncture, Treatment for Insomnia. Third clinical trial is to treat depression with transcutaneous electrical cranial auricular acupoint stimulation, TCAS. Last one, the clinical trial undergoing is pediatric massage for children with autism. So this shows how cranial auricular acupuncture stimulation work. So we just put two electrode to here, Inta and Baifei. So another pair of the electrode put here in the air. So this is called cranial auricular acupuncture stimulation. So just a conclusion summary. Acupuncture stimulation therapy are beneficial and effective in treating the various psychiatric symptoms, especially mild to moderate mood and anxiety, the dementia, and also can maintaining the mental well-being. Especially we can use TCAS and acupressure because this kind of acupuncture treatment is more convenient. So we could recommend this model, acupuncture model, into clinical practice. About Chinese herbal medicine, we'd like to recommend to serve as option, particularly for comorbid symptoms and antipsychotic drug-induced side effect, such as body weight gain and movement symptoms. So I just quickly report about our work done over the past 5 years. If you have wanted to get more information, you can send an email to me. Thank you.